I'm Debbie Statler, Editor-in-Chief of Provider Magazine, and today I'm here with Chris Wright, Chairman and co-founder of the iCare Health Network. Thanks for being with us.
Thank you for inviting me.
Well, let's start at the beginning. Tell us a little bit about yourself and especially how you came to be involved in long-term care.
Well, it is an interesting journey. Actually, I started out as a CPA. I thought that I wanted to be an accountant. I did auditing, and what I found out was that auditing numbers and stuff was great. It was a great career. And I got involved in auditing a skilled nursing facility company. And then I realized when I did that, something really occurred to me. I don't know if it was, I don't know what it was. It just that came to me that I realized, yes, I thought my career would be in numbers, but I realized there were people behind the numbers. And then that really led everything I've done today in getting involved in long-term care. And I think fate would have it because there was a new office building being built outside my window when I was an accountant. And I wondered what it was. And it was going to be a central office for a Southeastern-based nursing home company that already had been established. And long story short, I was hired by them. They wanted an accountant out of CPA. And then I just worked my way up as VP as budgeting and planning. I learned the operations. I got to meet very interesting people, the administrators, and I saw the caregivers, and it just sort of melt my heart as far as, this is the kind of career I want to be in. Something with numbers, but it's people behind the numbers. So that has really led everything to what I am today.
It's amazing how many people I speak to that have such a personal connection that gets them involved in long-term care. So you talking about the people behind the numbers, it's so true. And it really leads to a career where you make such a difference.
That's exactly right. It's a very hard, as you know, this is not an easy job. It's probably not the most grandiose job that people want to be in. And, but it's very rewarding. It's very rewarding.
Indeed. Well, as the incoming chair for the AHCA board, where do you see sort of long-term care going? What's the vision for the industry?
Well, I've always said, and I say it to my folks, when we have tough times and we worry about reimbursement and policies, I say, listen, skilled nursing care, because we're all skilled, my abilities, I don't have assisted living. Skilled nursing care is not going to go away. It's okay. So yes, there's going to be some struggles on how we get reimbursed and how, we're going to be at the oversight and the regulations. But I see with this profession, it's going to explode even more because, as you know, the numbers are telling us that by 2030, it's probably going to be about 15 million more baby boomers reaching 80. So about 3 million a year starting from now. So one of the things that I think that as a profession, I think we have to also be very careful and listen to our consumers. I think they really have more choices. So I think we have to find the right niche in skilled nursing and be sure they're at the right level of care. And I think that's things, there's opportunities, not just for skilled or assisted living, but all in between the continuum of care. So I think there's tremendous opportunity as well as we move forward.
It's such a great point because the baby boomers really almost have different expectations of how things are going to be when they reach that stage. So it's such an area for opportunity and growth.
Right.
Well, what are some opportunity and challenges for long-term care as a profession?
As a professional, wow, that's a good question. Well, again, I think that the challenges, I'll take the challenges first, is as we've already talked about, the workforce is a major challenge, as you know. We have made stride in that, and people are getting where they need to be pre-pandemic. As far as other challenges, it's just the survey and regulatory process. We have to work on that, and I know that's one of our, as AHCA, we're really pushing the Better Way program. So I definitely see that as an opportunity, not so much as a challenge, but it's kind of both. We have the opportunity, but it's going to be challenging. It's kind of like, navigating a Navy ship in a pond. How do you get that to turn? It's the way I look at CMS. It's like this big Navy ship in a small pond, and we got to turn it. So it's not going to happen every time, but we keep the connections. We advocate, and the main thing, we stay united as an association.
I couldn't have said it better. Staying united as a group absolutely makes things happen. Well, a little more personally, what is your vision for your time on the AHCA board?
I've thought about that a lot, and people have asked me my vision. So I think it's pretty simple. I think it goes back to my roots. First of all, I said people behind the numbers. And so I think if there's people behind the numbers, sort of coined my vision for AHCA as chair to keep in mind what our mission statement is, and that's improving lives by delivering solutions for quality care. But I kind of coined that as the 3 Ps. The 3 Ps would be people, purpose, and progress. So there are people behind the numbers, there's purpose behind our work, and then we'll make progress. And I think that all comes together if we stay united. So my vision is to continue to the momentum we have on deregulation, the vision, and to keep in mind that we're talking about people, and that's what we got to advocate for when we go to the legislators, when we go to the officials making policy, that the truth behind your policy and anything that you do for long-term care and oversight, I'm going to remind you, there are people behind those policies. That's the truth. So that's sort of my vision, and I keep that in focus, and obviously work collaboratively with the rest of the board member, all the constituency groups, and just to be sure they have a voice, and one of the things too, I mean, my vision, I always said this when I've been advocating on the state level, when I was back in the day, when I go in and speak to a legislator or policyholder, I said, don't see me. I want you to see the 15,000 plus facilities that we have, the 5 million residents that we take care of throughout each year. That's who's here. Don't look at me as the person. I'm representing who they are. I'm serving them in the best that I can.
Absolutely. Keeping those people and their stories right in the center.
Progress.
Beautiful. Well, we look forward to hearing more things from you, Chris. Thanks for being with us.
I appreciate it.